Hi, my name is Sandra Willis and I am a DNP student at East Carolina University. As a DNP prepared nurse, it's important to understand policies that affect you and the patients you care for. For this presentation, I am going to discuss vision care for North Carolina adult Medicaid recipients. For this policy analysis, I have two problem statements. The first one: would providing routine eye exams and corrective visual aids to adult Medicaid recipients improve overall health of these individuals? And number two, what is the potential economic impact of providing routine eye exams and visual aids to adult Medicaid recipients? Our eyes are the windows to the world. Maintaining healthy vision is an important aspect to overall health. Having a comprehensive dilated eye exam is one of the best things a person can do to keep their eyes healthy. A comprehensive dilated eye exam is able to detect ophthalmic problems such as retinopathy, glaucoma, cataracts, and age-related macular degeneration. Some of these ophthalmic conditions can cause permanent vision loss or blindness. However, in North Carolina, Medicaid adult recipients over the age of 21 do not have coverage for routine eye exams or visual aids. Reducing health disparities across our nation is one of the main objectives of Healthy People 2020. Vision is an important aspect of everyday life and affects how we communicate, work, play, and interact with the world. The goal to improve visual health of the nation is through prevention, early detection, timely treatment, and rehabilitation. An eye care professional can prescribe corrective eyewear, medicine, or surgery to minimize vision loss and help a person see his or her best. Having healthy vision can keep people safe while driving, working, and prevent injuries. The American Diabetes Association's current position statement recommends that adults with type 1 diabetes should have an initial dilated and comprehensive eye exam within 5 years of diagnosis to detect and prevent worsening retinopathy, whereas type 2 diabetics are recommended to have an exam at the time of diagnosis. Subsequent eye exams are recommended at 2-year intervals or yearly if there's evidence of retinopathy. Diabetes-related retinopathy is a leading cause of blindness in the United States. Glaucoma is the second leading cause of blindness worldwide. With its insidious onset, it is often associated with diagnostic delay. Data supports that examination by an ophthalmologist is the most accurate way to detect glaucoma. Poor vision also places adults at greater risk for falls. Falls are a leading cause of mortality among older adults worldwide. Visual impairment has a critical role in fall events, particularly related to trips, slips, and falls due to environmental hazards. Income affects how visual impairments are detected and treated. As noted, routine eye examinations and corrective visual aids can improve visual health. Without sources to provide professional care, disparities are noted especially in the areas of diabetic retinopathy, glaucoma, and macular degeneration. In the United States, there are notable economic, ethnic, and regional disparities for vision care. In a cross-sectional national representative sample study by Zhang et al., it was found that those with lower incomes were consistently less likely to have an eye exam in the past 12 months than those with higher incomes. Medicaid is a health and long-term care coverage for low-income adults, children, pregnant women, elderly adults, and people with disabilities. Here in North Carolina, there are over 2 million individuals enrolled in this program. One area that is not covered for adults under the Medicaid program is routine eye exams and visual aids. In 2011, $16.5 million in Medicaid funding was cut. affecting adult routine eye exams and glasses as part of the budget plan. These cuts may seem innocent on the surface, but the negative effects of vision loss are likely to lead to higher healthcare costs later and the potential loss of independence of many of our residents. However, funding cuts were inevitable. Those involved with the decision making at the time noted that the department looked for the least damaging options for cuts in the Medicaid budget to overall health. Geographic disparities of severe vision loss are noted in the United States. In the U.S., 77.3% of counties in the top severe vision loss prevalence were located in the South. Routine vision exams can reduce the incidence of vision loss. In 2013, the total cost of vision problems was estimated at $145 billion. However, interventions to detect and manage early eye conditions leading to vision loss remain uncovered by many healthcare programs. Vision care for adults enrolled in Medicaid is an optional service that's determined at the state level, including no coverage provided for the state of North Carolina for adults. States often add or drop optional benefits such as adult vision services based on budgetary considerations. Surplus funds could be used to fill the gaps for routine eye exams and provision of visual aids from adult Medicaid recipients in North Carolina. Several options should be considered. The first option is to continue current funding restraints for Medicaid adults and rely on personal resources to fund eye exams. However, statistics show that this is not a viable option, as uninsured adults do not effectively utilize preventative eye care. Another option is to explore available resources for the uninsured or underinsured and use funds to educate primary care providers in the community about these resources. The National Institute of Health provides information regarding financial aid for eye care. Some of these resources include Eye Care America, that provides free eye exams for people 65 and older at risk for glaucoma. Vision USA provides free eye care to eligible low-income and uninsured people working with a charitable organization, social worker, or community health agency. The Lions Club International, they help buy eyeglasses or get eye care. Mission Cataract USA, free cataract surgery to people of all ages. And New Eyes, this organization provides vouchers for new eyeglasses. And there are also several prescription databases for free or low-cost meds. Another option for the committee is to donate surplus funds to these organizations. However, donated funds may not go to the Medicaid adult recipients of North Carolina. Finally, a fourth option is to develop a task force of advocates to propose changes to current Medicaid limitations here in North Carolina. While routine eye exams on all adults with Medicaid could prove too costly for the state budget, many individuals could benefit significantly from these services. Many Medicaid recipients require prior authorizations for medications, durable medical equipment, and procedures. So why not consider a prior authorization for routine eye exams and visual aids, which could be a viable option for this population? Developing this task force to determine potential eligibility for these services may prove economically a sound decision process. The task force should suggest Medicaid prior authorization of preventative screening for persons affected by a personal history of diabetes or a family history of glaucoma or age-related macular degeneration. Long-term savings could be seen by funding early recognition and treatment of these conditions, as recommended by the task force, and presented to legislation. I would like to recommend this fourth option, despite the potential negative aspects from legislative budget constraints, as the option that would benefit the most throughout the state if proposed changes were made. Multidisciplinary individuals would be helpful on the task force, including those with a financial and political background. Being a DNP prepared nurse It's important to understand healthcare policies and be an advocate for those in our care. Policy analysis is one way to accomplish this task. Listed in the next 3 slides are the references that I use for this presentation. I hope that you were able to learn something about policy analysis and how it affects those that we care for. Also, I hope as a DNP prepared nurse that we take on this responsibility and look at policies that affect us and our patients and be an advocate for them to help make changes in our communities.